Good morning, everyone, and thank you for the kind introduction, Patrick. I'm happy to host this session about innovation through co-creation and partnerships this morning. My name is Katariina Rouvinen. I work as a development manager in HUS Helsinki University Hospital. I work with company collaboration and innovations, and I'm happy to start this session. We will have 5 presentations from Finland and from abroad, and then we will have a panel discussion afterwards. I will start shortly about HUS Helsinki University Hospital, what it's about, and then our one innovation ecosystem initiative we have called CleverHealth Network. Maybe some of you are well aware what is HUS Helsinki University Hospital, but here in brief, we are the largest hospital organization in Finland and one of the largest hospital organizations in Europe. We are offering specialized medical care for our inhabitants. In our area, in Helsinki and Uusimaa area, there lives about 1.7 million inhabitants. But we have a larger catchment area for tertiary care, and there is 2.2 million inhabitants. But there's some specialized care that is taking care in our hospitals nationwide. So in whole Finland, there's about 5.7 million people, and we cover, for example, organ transplants and some kind of treatments for children's diseases. We have 21 hospitals and about 28,000 employees in our hospitals. We are the second largest employer in Finland after the city of Helsinki. And annually, about 700,000 patients are treated in our hospitals. We are leading development of digital services in healthcare in Finland, and last year Finland was ranked first in DigiBarometer indicator that evaluates countries according to how they enable, utilize, and benefit from digitalization. And what are the drivers for healthcare digitalization? These are very familiar for all of you. Aging population. So the increasing of chronic diseases, it's worldwide challenge. So we need to develop more efficient services. Finland is a long country, and there's a shortage of manpower. But fortunately, our patients, they are willing to use digital services. And the technology is rapidly developing, and we have a lot of amount of data that we can use to develop new solutions, new services. And with the help of AI, we can develop these services. One of our innovation activity in Helsinki University Hospital is CleverHealth Network. That is an open ecosystem for public and private collaboration. We are combining in this ecosystem our clinicians from our university hospital and the expertise of private companies. And together with our clinicians and companies, we are co-creating new solutions for global markets. And in these projects, we are utilizing the health data that we have in Helsinki University Hospital. We in HUS, we are responsible for the scientific research and the validation of the solutions in these projects, and the companies are responsible for commercialization of these solutions. We've been running and coordinating this ecosystem for 7 years now, and it is funded by Business Finland and the partners we have in our ecosystem. Here you can see our partners at the moment. We have 20 partners. We have both SMEs, growing companies, scaling up companies from Finland, and international companies. We have medtech companies and also companies from pharmaceutical industry. We are coordinating this ecosystem together with Spinverse consulting company, and as mentioned, Business Finland is funding this ecosystem. But we have a lot wider ecosystem. In our projects, we can have other companies also, which are not in our core ecosystem. We're trying to find the perfect partners for each project that we have. So we've had a lot of other companies, research institutions, and other stakeholders also. We are collaborating actively with EU projects that we are coordinating in Helsinki University Hospital. Health Capital Helsinki is very important, our stakeholder in our network. Also Terkko Health Hub and Biodesign Finland. Health Proof Helsinki is one initiative where we work together with City of Helsinki and Metropolia University of Applied Sciences, where we offer expert services for companies and testing facilities. And we also have other stakeholders. And about our projects in CleverHealth Network. So these are joint development projects, and there are 3 main elements in our project. Yesterday we heard about need-led or idea-led needs, and in these projects we need to have a clinical need. So we need to have some clinician who has some kind of idea or challenge or idea that he or she wants to develop together with companies. In our projects, we are utilizing our health data that we have a lot, and then this joint development co-creation with companies. So we are doing something new together, something that has not been in market yet. So we are doing something new together. And the solutions will be taken into use in our hospital, and the commercialization, as I mentioned, and the actual business is taken care by the companies. And we are making contracts for each project individually. And as I mentioned, the data is very crucial in our project. Here you can see some numbers about the data we have in HUS Data Lake that can be used via HUS Acamedic, which is a secure, scalable, and virtual research environment. Here is some project examples that have been in our ecosystem. So the development of home dialysis is the first project that we have come come up with the Fujitsu, and they will commercialize the solution. So they have been developing a solution for patients suffering dialysis, and they come up with the app that the patients can treat themselves at home and have a connect with the clinicians in the hospital. Head area imaging analytics is going on. They are developing different kind of algorithms to detect different kind of brain bleeds. Gestational diabetes, you will hear more later today. My colleague Mikko will present that project afternoon. And then there's AI tool for diagnosing for rare diseases, and also AI tool for treatment of acute leukemia. And there's some other EU projects that we are involved also. And this was shortly about how we collaborate in Helsinki University Hospital, what kind of innovation activities we have. We have, of course, a lot of other activities and initiatives, but this is one of our ecosystems that we collaborate with the companies.